Hi everyone, welcome to GlucoseZone. Tonight's diabetes talk is about the 3 ways to prevent diabetic retinopathy. So I don't know if you remember me, but last week or maybe the week before, I did the diabetes talk with Laura and we did Nutrition 101. I am Lori Ann. I'm the diabetes educator for GlucoseZone, and we are going to talk about diabetic retinopathy, and we're going to talk about what it is, why someone with diabetes is at higher risk, and the 3 most important things that you can do right now to lower your risk. So if anybody has any questions or any comments while I'm speaking, please feel free to type them in. And hello to Jeanette. I'm so glad that you're here. And let's start talking about diabetic retinopathy. So in that, I'm going to put on my glasses. Okay. People with diabetes are at greater risk of developing diabetic retinopathy, and it's an eye disease. And the reason why they are at greater risk is because the elevated blood sugar levels, because of diabetes, can actually damage the blood vessels of the retina. So diabetic retinopathy, when the damage occurs to the blood vessels, it causes issues that can lead to swelling. And the retina is where the damage occurs. The retina is the tissues that are at the back of the eye, and they line the eye on the inside of your eye. So if you think about your eye as kind of like a ball, in the back of your eye is your retina, and the damage occurs because these blood vessels in the back of the retina swell. And that affects your vision because these, the retina, the cells of the retina, are what are responsible for your ability to see. So when light comes through, it gets focused, and it focuses on the back of the retina. That light is then converted into signals that are nerve signals, and these signals are then sent to your brain, and then your brain interprets those signals as vision. So obviously, if your retina is damaged, then your vision will be damaged, and that's one of the things that we're really concerned about. So if you start having these symptoms, like if you start seeing things that float by, or if you see things that are blurry, or there are dark areas in your vision, or you have trouble distinguishing color. Now, I don't mean like you can't match your tie with your socks or your pants or shoes or something like that. I mean that you actually, what you used to think was like brown or blue might seem different to you. So if you have any of those are early signs. And if you're experiencing you just notice that maybe your vision becomes a little blurry, and more so than like if you need readers or something like that, like actual blurry vision, like you have trouble reading signs from far away, or you have trouble reading your books that you normally didn't have issues with. Maybe you see things like double vision, or maybe one of your eyes or both of your eyes hurt. Maybe if you notice that your eyes get red and the redness doesn't go away, you feel pressure in your eyes, or like you see those floaters that go by, or you see spots that don't fade away, like if you're looking at light and then you look away, but those spots don't fade. Maybe straight lines that normally look straight to you actually don't look straight anymore. Or if you have trouble with your peripheral vision, meaning that you can't see things that you normally could see at the side when you look straight ahead. then you need to get yourself to your doctor. So let's see, if anybody has any questions, again, sorry, this is my second time, so I'm getting used to it. So diabetic retinopathy is basically a general term, and in terms of diabetic retinopathy, there are actually two kinds of retinopathy. There's the non-proliferative, which is usually the first, when somebody's initially diagnosed, they'll usually have non-proliferative. And then there is proliferative. So non-proliferative retinopathy is the most common form. And when people have non-proliferative retinopathy, basically the capillaries that I explained were at the back of the eye, they start to swell, they balloon out, and they form pouches. And this is problematic because your capillaries basically are supposed to be, even. They're supposed to be the same amount of pressure that maintains the fluids inside. But when your blood sugar levels are high, this causes them to become swelled and also to become very sensitive. And they start to become, things start to leak out. So they might get blocked, fluid might leak out, and as I said, this is kind of the early stage of retinopathy. So if people have this, the trick is, at this point, if you start having any of those symptoms that I mentioned, like, you feel pressure in your eyes, or your vision has changed, it's a really great idea to get yourself to your eye doctor. And I'm not sure if most people have been told to go to see an eye doctor, but as a diabetes educator, that's one of the things that I really feel very strongly about, that it's important for you to get to see an eye doctor. And so we'll talk a little bit more about this. So as I mentioned, this retinopathy, which is, as I said, maybe possibly the first stage where your capillaries start to leak, they start to form pouches, the blood vessels are blocked, and at this point, the macular area, which is at the back of your eye in this retina, starts to get fluid on it, and it swells. And this actually is called macular edema. And so when the capillary walls start leaking, the fluids start to fill up this macular area. And again, this is the part of the eye, like the back of the eye is what I'm showing you, where the focusing occurs. So if you're starting to notice any type of blurred vision, this is a time where you can get yourself to the doctor and have your eyes examined. And if you catch it at this time, it's a really good time, because this is where it's the non-proliferative, and at this point things can be interventions can occur, your doctor can treat you, you can start working on your blood sugar levels to get them under control, and that could be the stopping point of the retinopathy. So for macular edema at this point, if you start noticing any changes, it really should be treated. And fortunately, at this point, treatment is really effective at not only stopping, but sometimes reversing the vision loss that occurs. And many people with significant macular edema have no symptoms and have good vision. So at this point, as I said, where you have this non-proliferative retinopathy, it's a really good time to get yourself to the doctor, have an eye exam, get a diagnosis, and have treatment, because at this point you can get diagnosed and you can get treated, and during this early stage, you can prevent future visual loss. So for many people, as I said, this non-proliferative stage is the end of it. People have been diagnosed with proliferative retinopathy, and they're able to stop what happens, and you can get great treatment and you can move forward with your life where things really are no different. However, the next stage, which is proliferative retinopathy, the blood vessels become very damaged. And during this damage that occurs, the body, in all its wisdom, because you can't get blood flow and you can't get oxygenation to your cells in your eye, the body starts to close off the blood vessels that are no longer working, and new blood vessels start to grow in the retina. So if you remember what I said, in your retina, the back of your eye, that's where your vision occurs. And it's really this nice surface where you're able to, where your body is able to, focus the light sends signals, as I mentioned, to your brain, and you're able to, have vision. But what happens is, with proliferative retinopathy, the blood vessels become so damaged, cells can't go through them anymore, the eye cannot get oxygen, and it can't get nutrients. So what happens is the body, in its wisdom, starts to grow new vessels. And as you can imagine, when this starts to occur, these blood vessels start to block the body's ability to focus the light, and so vision starts to get affected. Now, these new vessels that the body grows, while they're beneficial and they're able to help the body in terms of oxygenate and provide nutrients, what happens is scar tissue starts to grow, and this scar tissue grows, the swelling occurs, the scar tissue swells, it shrinks, it swells, and it shrinks. And as this happens, the retina gets pulled out of place. And I don't know if anybody has ever heard of it, but there is something called retinal detachment, and this actually is one cause, not the only cause, but this is one cause of retinal detachment. So one of the things that we like to keep in mind is that for many people, it's really important that they get yearly eye exams. When you're diagnosed with diabetes, whatever your age, even if you were a young child or a teenager or in your 20s, it was recommended by your healthcare provider that you have a yearly dilated eye exam. And for anybody who has been diagnosed recently, hopefully you'll remember that not only were you diagnosed by your doctor, and your doctor or your diabetes educator then went over everything that has to do with taking care of your blood sugar and taking your medication, but also your healthcare provider talked to you about diabetic retinopathy or diabetic neuropathy. And hopefully one of the things that the doctor recommended is that you go ahead and get this dilated eye exam. So the dilated eye exam is a yearly exam. The doctor will dilate your eyes, and hence the name dilated eye exam, because what it does is it opens up your pupil so the doctor can actually look really, really carefully at that whole back of your eye and see what is going on. And if you have a yearly dilated eye exam, then your doctor will be able to monitor and notice any changes that occur before you start to have any of those symptoms that I mentioned before. The recommendation, as I mentioned, is to get a yearly dilated exam unless at some point in your treatment, your ophthalmologist tells you that you need to get the exam more often. And the reason why the doctor might tell you to get the exam more often is because maybe they notice some changes that are occurring, or maybe your blood sugar is not as controlled as it used to be, or maybe you're just getting older. There are many, many reasons why you would, why your doctor would recommend that you get it, more often. But the recommendation to start is to get the yearly dilated eye exam. So, number one of the 3 ways that you can prevent diabetic retinopathy is to have the yearly dilated eye exam. And once you go to the doctor's office, you'll go in, and the doctor will examine your eyes, and then the doctor will put drops in your eyes and to dilate your pupils, meaning make them open up wider. The doctor will have you go back into the waiting room and wait while your pupils open. And so then after a bit, the doctor will bring you back into the office and will have a look at the inside of your eye so that the retina, again, which is the lining of the back of your eye, and your optic nerve, which is the nerve actually that goes to your eye, can be looked at. And this is a really important exam, and as I said, I stress it all the time. When I was in patient care, I always talked about getting the yearly eye exam and the yearly dilated eye exam because, again, it's really important that you have your eyes looked at, and it's also very important that you have this regular, a record of what your eye looks at. One of the things is that the person who is doing the eye exam is an ophthalmologist. And for most people who have diabetes, this yearly dilated eye exam is covered by insurance. So an ophthalmologist is the person who you're going to go to. Many people go to an optometrist for eyeglasses or contact lenses, and can get the exam there. But it really is recommended that you have the exam done by an actual ophthalmologist. So as I said, number one of the 3 ways that you can prevent diabetic retinopathy is to have a yearly dilated eye exam. And if anybody out there is listening and they've recently had their eye exam done, that's awesome. I'm really happy to hear that. And you have 12 more months before you get your next one. So once you have your dilated eye exam, as I said, your pupils will be open wider. Your eyes will be more sensitive to light and glare. So once you're leaving the exam, you may want to bring sunglasses with you. Some people, if they have already some symptoms of diabetic retinopathy, their vision might be such so that they don't feel comfortable driving themselves home. So you may want to have somebody drive you to the exam and drive you home so that you don't have to worry about feeling uncomfortable if you feel that your vision is impaired. One of the things that I want you to keep in mind is that this damage from diabetic retinopathy doesn't just happen like this. It's something that's progressive, and so the condition it starts, it gets worse, it gets worse, it gets worse. So it's really important that you have regular checkups. And as I mentioned, for many people who have diabetic retinopathy, they might have the non-proliferative, and that might just be it. They might have that, and they might get the treatment, and they might get their blood sugars under control, and that might be the end of it. So damage to your eyes from diabetic retinopathy does not just happen. It is progressive, so getting regular checkups is important. What you do today for your eyes is important for how it will impact you 5, 10, 15, and even 20 years in the future. So I always tell my patients, have your eyes checked today to ensure that you will maintain good vision for tomorrow. So if you think about what you'll miss seeing, it's really important that you get your eyes checked. And many times people don't like to talk about the B word, but I'm actually going to mention it because it's really important that blood glucose really is important. And it is a B word, but the B word that I'm talking about is blindness. And so having regular checkups will make sure that you keep an eye on the progress that's occurring with your eyes, so that if something is going on and you're able to keep an eye on it, literally, and your doctor's able to keep an eye on it, it's less likely that your vision will deteriorate to the point where you won't be able to see anything. So if you think about, what it is that you'll miss, would you miss seeing your kid's face or your grandkid's face or your animals or your children or, the sunset or flowers? It's really important that you keep that in mind and just go and get your yearly dilated eye exam. So talking about blood glucose, everyone knows that blood glucose levels impact your vision. I know that when I was in practice, many of my patients actually discovered that they had diabetes because their vision became blurry. And there was a change, and they noticed that they really couldn't see the way they saw and in the past, and then they went to the eye doctor, and their eye doctor was the one who actually diagnosed that they had diabetes. So keeping your blood sugar levels in a healthy range will help ensure that your eyes remain healthy. So what is a healthy range? If you've been watching the other diabetes talks before, you know that that we have the glucose zone levels between 100 and 154 for your exercise. But for blood sugar levels, that for the American Diabetes Association recommends aiming for blood sugar levels that are between 70 and 130 milligrams per deciliter. And I have a table here that I can tell you, anybody who's listening in other countries that use millimoles, I will tell you that that's about 4.5 millimoles per liter. So 4.5 to about 8.0 millimoles per liter equivalent. So it's really important that you aim for that level, 70 to 130 milligrams per deciliter, before meals, and under 180 milligrams per deciliter 2 hours post-prandial, which is 2 hours after meals, and that is a level of 10 millimoles per liter. And keeping your blood sugar levels in that range will help you avoid developing diabetic retinopathy. Now, your doctor maybe has different numbers for you, so you may want to talk to your doctor, because depending on your medication, you might have a different range to go in. So number 2 of the 3 ways that you can prevent diabetic retinopathy is to keep your blood sugars under control. And I can't stress that enough. Last night when I was preparing for this diabetes talk, I called a friend of mine, Stephanie Sugin, who's a doctor. She's a retinologist right here in Connecticut at the Eye Center. And that was when I said to her, I left her a voicemail and told her what I was going to be talking about today, and she said one of the most important things that she tells her patients is get your blood sugar under control. Now, if you have had an A1c of 11 or 10 and you want to get your blood sugar under control, it's really important that you don't just go from an A1c of 11 to an A1c of 6 really quickly by, really tightening up your control. The recommendation is to do it slowly, because during that time period when you're changing, you can have your fluids can shift, and if you already have diabetic retinopathy, those fluid shifts can actually cause damage. So the recommendation is to get your blood sugars under control gradually, and then to keep them under control. And as I said last week or the week before, we did the talk about eating, healthy eating for diabetes. So look back at that, and that will give you some guidelines in terms of what you can do to get your blood sugar under control. And then also take a look at the green juice video that we did, because that's also another really good talk that we did about nutrition. So poorly controlled blood sugar is a real risk factor for diabetic retinopathy. And so it's important, as I mentioned, to keep your blood sugars under control. Now, it's really important to remember that there's been years of studies that we have to prove that it's important to keep your blood sugars under control. And it was seen in many studies that people whose blood sugars were close to the ranges that I just gave you, the 70 to 130 milligrams per deciliter, were less likely, much less likely, like a quarter, to develop diabetic retinopathy. And if people who already had diabetic retinopathy, when they were able to get their blood sugars under control, it progressed much slower and less often in people who had better control. So remember that you actually have a lot of control over what happens to your eyes. So one of the things that the number 3 of the 3 ways that you can actually prevent diabetic retinopathy is fourfold. So number 3, I know I cheated, because there are really 4 other things that are very important for you to do to help keep your blood sugars under control. And the first one is to actually know your A1c. So if you were to come in and meet with me, I would ask you what your A1c was, when did you have it done last, and obviously you would say, oh, I had it done 3 months ago or 2.5 months ago, and I'm having it done in another 2 weeks. So it's really important to know your A1c and to have it tested on a regular basis. So that's number 1 of the 3rd ways to prevent diabetic retinopathy. The other one is, if you have high blood pressure, to bring your blood pressure under control. And if you can think about what I was talking about, leaking fluid and the capillaries that get leaky, if your blood pressure is elevated, there's more pressure that's pushing against those very delicate capillaries in your eyes. So it's really important that you make sure that your blood pressure is under control. The other thing is to, if you have elevated cholesterol levels, to get your cholesterol under control. And if anybody is interested in hearing about that, let us know. We can do a talk about cholesterol. And the other thing, which is really important, and this impacts so many aspects of your life, is if you currently smoke, to really make a concerted effort to quit smoking. Smoking is really detrimental, not only for people who have diabetes, but also for people who don't have diabetes. So if you have diabetes, it's important that you quit smoking. If you're living with somebody who smokes, encourage them to quit smoking as well. So the number 3 of the 3 ways that you can prevent diabetic retinopathy is to know your A1c, get your blood pressure under control, lower your cholesterol, and quit smoking. And if in fact you do need to have treatment for diabetic retinopathy, years and years ago it used to be a tough thing, but right now new things new methods have occurred, have been discovered, so that you can rest assured that even though it may not be the most pleasant thing, it's important to get your eyes checked, because if you do something now, you will be able to have your vision for the future. So the treatments for it are laser. There are injections, which sound really horrible, but they're not as bad as they sound. You can have surgery to remove the buildup of the leaking fluid, or to remove scar tissue, overgrowth. And as I said, there are other new methods. So thank you so much for listening to me. And I really appreciate people. I'm glad, Jeanette, you're interested in talking about cholesterol. Thank you. I do want to give one more shout out to my awesome friend, Amy Sullivan. She's also a diabetes educator, and she helped me enormously kind of put my ideas together. So thank you so much, and I appreciate everybody listening to me. And if you have any questions, anything that I didn't address about diabetic retinopathy, please write in, and have a great night. And remember, everybody, please go get your yearly dilated eye exam. Thanks so much. Take care. Bye.